Well, I just have to say, Altaf, it is such a pleasure to be here with you, sharing space over the next half hour. I see people are joining, and I see it's people from within MGH and outside of MGH. So welcome, everyone. And I think this is going to be fun. It's really, really good to see you today.
Yeah, I know we had mentioned this offline, but yeah, it's been a long time since I first met with you when I was a medical student at HMS and saying, I'm interested in disparities and can I make a future out of this? So it's nice to now be here with you 10 years later and having had that relationship since.
I thank you for starting with that, because that's been a lot of my reflection over the last few days. You were thinking about a career in neurology. I was starting as a faculty member at MGH Neurology. And, since then, you are a neurologist. You were chief resident at MGB Neurology. You left for your fellowship, came back, and now you're on faculty and are doing really, really amazing things. So I am curious, nowadays, what are you up to? What exciting projects do you have going on? What is bringing you joy in those projects? What are challenges that you're facing? What's life like?
Yeah, so I am working on a lot of different projects, probably too many projects, but I'll tell you about two that are neurology related and then two that are non-neurology related. And I think that sort of segues into some of the challenges because some of the work that I do doesn't fit within neurology. But two neurology related projects. So one of them, which is overlapping interest of ours, is looking at the care that patients with limited English proficiency get in neurologic care. And, I think in neurology, especially, it's a specialty where we rely on what the patient is telling us and sort of their cooperation with the exam to really inform even the tests we order and our diagnoses. And it's a place where I've seen patients with LEP, limited English proficiency, really fall through the cracks. So even I remember from residency, a patient who, was billed as having dementia, but really getting the right interpreter, talk to them. And it's like, nope, this person just needed an interpreter to, and they are with it and they don't have dementia, or even cases of people who had gotten, $1 million workup, but really it was more sort of a shortcut for just getting more information when you could have sat down and talked with the patient through an interpreter. So I'm really interested in thinking about patients with LEP sort of within neurology, and have funding from the American Academy of Neurology to look at that using national sort of data sets, but then also have some projects looking at differences in care institutionally as well. And then another neurology related project sort of relates to my work with asylum seekers and refugees, which is thinking about traumatic brain injury. So I started doing asylum evaluations for folks in 2017. And I was, at the time, I started with Physicians for Human Rights, and I was at that time, the only neurologist in their national network. And people said, oh, you're not going to really do any neurology cases. It's just going to be non-neurology. And I said, that's fine. I care about this population. But obviously with sort of my hat as a neurologist, would ask questions and saw a lot of traumatic brain injury, right? And we know even in the context of intimate partner violence and other types of violence that TBI is a big component of that. It might be something that people don't ask about, or it might be something that overlaps a lot with PTSD symptoms, for example, and so gets missed. But I think because of my lens was something that I picked up on. And so really trying to build sort of characterizing that within this population and hoping to move towards thinking about sort of community tailored interventions addressing that. And then two of my non-neurology related projects. One is a continuation of work that I had started as a fellow. Was really sort of fascinated about the idea of what it means to create sanctuary or safe spaces in the healthcare context, and specifically for immigrants. And so created, did a multi-state study looking at what hospitals and health clinics were doing to sort of create immigrant-friendly spaces. And now I'm sort of in phase 2 of that, which is really getting patient perspectives on what makes a health system trustworthy. And so we just started sort of surveys and interviews out of a site in California, and then are going to be starting this month out of 2 sites in Massachusetts. And hopefully can get funding to make it in all the 5 states that I had done the first project on. And then another non-neurology related project is one that's in collaboration with the ACLU, and we have funding from NSF and the Russell Sage Foundation, and it's with a wonderful collaborator who's a sociologist at UC Davis, Dr. Patler. And we're looking at the impact of release of individuals who've been released from immigration detention in the context of the pandemic, and how that influences their health, but also the entire household's health. So we're looking at sort of the individual who was released, but also a spouse and a child, and looking at that longitudinally over time. So some neurology, some non-neurology, but all sort of focused on displaced populations, which is sort of a population of interest of mine. I'm thinking about social determinants of health and structural determinants of health.
I have to say, as I listen to you, we as clinicians or scientists, or maybe we as people, put things in boxes, right? And maybe our brain also puts things in boxes, but I find such overlap between everything that you just shared. And I think of it all being neurology and all having implications beyond neurology, because, people living with neurological diseases sometimes are immigrants, sometimes are refugees, sometimes need safe immigrant spaces. And whatever we do with regards to how we care for patients with limited English proficiency in the neurology world has implications for other fields. So what you're doing is really, really important, definitely for neurology, but I dare to say, well, beyond it. I'm really happy to hear all of what you're doing. And I hear you describe, as I hear you talk about partners in this work, I see a smile in your face, and it seems to me that what you're doing is fulfilling and bringing joy. And at the same time, I hear you talk about some of the challenges, and one of them, as all researchers face throughout their career, is this idea of funding. And I wanted to pick your brain on that, on the type of work that we do in the health equity space, in the health justice space, in a subspecialty where this work is fairly new, and what your experience has been and what some of the challenges you're encountering are.
Yeah, I think to your point that you sort of started earlier, and I sometimes feel like I'm not enough of a neurologist in some spaces and then too much of a neurologist in other spaces. I think to your point, because this work is newer in neurology, so sometimes within the field, people are like, this doesn't quite fit into the mold of what we typically think about as neurology research. And then in other spaces, I think it's really new to have a neurologist. And so people are just like, wait, it's a double take that I'm a neurologist. So I think that is challenging. I think the part about funding, I think so much, I've been very, lucky, but I think some of the challenges is this point about, I think a lot of the funding mechanisms still try to get people to be in silos. And I think for equity work to be impactful, it needs to exist outside of silos. It needs to be cross-disciplinary within medicine, right? So neurology, cardiology, like every single specialty needs to be sort of working hand in hand on these same issues. And then not just within medicine, but outside of medicine, right? So I mentioned I have partners in the legal spaces. I have partners who are in the social sciences. I think we need to work with them. I think about even in the context of COVID, right? Like, yes, you can get the vaccine, but how you need to be working with social scientists about how you frame it. You need to be working with people in the equity space to get people to trust it, right? There's all these extra steps. It's not as simple as just coming up with a medication or you say, oh, there's all these extra steps that follow.
I completely agree. I completely agree. And, one of my reflections on that is around building a community of more and more people who are interested and engaged in both the neurology world and the equity world. And so I think of you as a mentor, and I think of you as a mentee, and I think of the power of mentoring in really exponentially advancing work that needs to advance as quickly as possible. So, I've had the privilege of having you as one of the mentors for our MGH Youth Neurology Education and Research Program. And I know that you've also served in other programs more recently through Harvard Catalyst. And I am really excited to hear how your take on any reflections on mentoring, any advice for mentors or mentees, reflections on that part of academia and your work.
I think, and I've been, I think a big part of it is recognizing that people may not have, I think sort of the best mentors have sort of recognized that I'm not going to necessarily have a career that's going to look exactly like theirs, and that's okay. And not trying to sort of fit within that mold. I have for my work around sort of TBI in this population, two of my mentors are in psychiatry and medicine. One of them, mutual mentor, Dr. Allegria, who's the Disparities Research Unit. I've also worked with Anna Maria Ranciano, who's in the psych department. And I think they've been so wonderful because they sort of recognize that, yes, I'm a neurologist, I sort of bring these different expertise, and they're not sort of pushing me in any way to be like, oh, you need to do this kind of work that I'm doing, and sort of recognizing where the overlaps are, but also recognizing the spaces that I sort of need to venture out and create new pathways. And but I do find, I think there's, and you probably feel this too, because there's very few of us in neuro who do disparities, anything disparities related, that sometimes it's a little overwhelming just in terms of like how many people are interested in the space and want mentors and want sort of projects. And I think it's great that you've sort of created the that mentoring program. But I think that's the one part, is I just wish that if I could have sort of more resources, that I could get more projects going and that I could get more students in. Because I think about that, my previous Altaf, who was thinking, should I not even become a neurologist, because there aren't people in neurology doing this work. And so there's a big drive in me that's like wanting to show people, no, you can do this work, and you should think about neurology and thinking about integrating it with this work.
The challenge resonates, and there's excitement, and I feel there's a sense of responsibility too. I'm passionate about this work. It needs to be done. Others are interested in this work, and how do we work together in a manner that's effective? And I really am, thankful to you for so many things, including helping develop the certificate for diversity and inclusion for the neurology residents at MGB to engage in this type of work in a more structured way. And also for helping develop the vision for, a program for all the neurology residents at MGB to learn about health equity in a structured way. Because it takes, I think there's several parts to engaging in this work, and I think many more people need to be engaged in this work. And one is recognizing that there's a need, and finding interest, and finding how our talents can be applied to advance equity and justice. So I appreciate what you're doing with your mentors and with other people being their mentor as this work moves forward.
Yeah.
So, sorry, go ahead.
No, I was just thinking, I think the other thing that I think about often is that, right, in other subspecialties within neurology or even other fields, right, there's all these like, let's say you're a movement disorder doc, right? But even within movement, you can have someone who focuses on PD, or you can have someone who focuses on like dystonia, right? You can have all these sub um, differentiation. And I think my hope for even the equity work is realizing that there's also so many different subsets of that, right? That even in terms of the research, you can do more programmatic stuff, right? You can do research. Even within the research, there's more like you can be doing epidemiological research, you could do intervention, you could be doing implementation, right? That there's community partnered work, and there's all sort of different methodologies, quantitative, qualitative. There's just, I think sometimes I get frustrated that it all sort of gets lumped into one thing. And I'm like, there's all these, in the same way that in other fields, I hope that the equity work will be seen in that way in the future as well, but there's sort of all these different subsets within that, and a range of things you can focus in on and sort of have as strengths.
That is so true. So true. And so I'm curious, Altaf, you mentioned some of the work that is currently going on. And as I think of all the challenges our world and our community is facing currently, including with regards to refugee and immigrant health, what are things that, of the work that is ahead, of the opportunities that are ahead, what are some of the things that you're most looking forward to?
It's a big question. I think that at least the way that I try to approach the research is really thinking about like and to me, community, right? You can have community engagement. There's a spectrum of that, right? You can have work that's community based. So you're just going out into the community, right? I practice at Chelsea, right? But you can have work that's community partnered and really informed from the outset by community or partners who sort of say, this is what's important to us. And so I think for me, that's something that I am really looking forward to. And I'll mention the project about the detention work. That was really new to me because I had been doing work with legal organizations and the ACLU sort of independently, just on individual cases, sort of pro bono, would review, let's say, someone's medical records, and I would write a letter saying, oh, look, this person has epilepsy. They've not gotten their medicine in 2 weeks. Please give them their medicine, right? So I would do like a lot of individual level advocacy. And I sort of wasn't sure how that would relate at all to what my research. Like it just sort of was like this something it's important to me. I'm just going to keep doing it. But this project came from them coming and saying, look, we've been involved in all this litigation across the country and all these people have been released. We trust you. Is there a project that you and your, Dr. Patler, who's I've also worked with, that you guys could come up with and think about using this to like advance the work with this group? And that was a really nice sort of segue in terms of the work that I do on the side into the research space. And I think it really came because that trust was there, right? There's really, I know like count of one hand of projects that are being done with patients in immigration detention because it's so difficult to get access to that population. But it really only came from several years of like trust building and them sort of coming to us. So that I really hope that happens more, of sort of people seeing that that I want to do this work in a truly partnered way. And even sort of the project from, I have my own ideas, but I really ideally hope that community organizations or legal groups can come and say, look, this is something that, so even like my thing, of being like, this is something that's we're coming across, we don't know how to handle it. Is this something you can help us answer? So that's, I think, my hope for continued projects in the future, is that it's really comes from not just me saying, oh, I'm interested in this, but partner organizations coming and saying, we need this. Can you do this for us? And how can, I'm thinking about how I can use sort of my expertise to help sort of move forward mutual missions.
your reflection here is so important because I wish for that too. I wish and there are people like that, and there are organizations like that who will see talent, will recognize talent, will develop trust in someone, and will be generous to say, what is your vision? How do you want to execute it? And let me support you. How can I support you? Because I feel, and it takes me back to the funding, I feel a lot of times there's all these structural barriers to get to what really matters, and what really matters to patients and to communities, and what really is talking to our hearts as researchers or clinicians. And so having that freedom of embarking on what you think is meaningful and will be fulfilling is just such a wonderful opportunity.
Yeah.
So I know there are people with us today, and for everyone here, just feel free to put in questions in the chat if there's anything in particular you'd like us to tackle as Dr. Saadi and I continue this conversation. So feel free to ask about anything around research, mentoring, health equity, neurology, whatever it is you'd like. In the meantime, I see you were about to say something, so go for it.
Well, Nicte, you know, I am so chatty that I will just keep talking.
The same thing.
I was just thinking about, even when I was interviewing for faculty positions, and I think this really speaks to our chair, Merit, Dr. Sokovich, and I was at UCLA, and then I was interviewing at different places. And there were some places where the chair sort of specifically told me that they would want me to tone down my non-neurology related work. And that was a big turnoff for me, obviously, that someone would say that. And I think it really speaks a lot to me. I always, even these different projects that I'm doing, that I just count my blessings to have a chair who's do your thing, sort of recognizing that equity work is going to transcend sort of our traditional disciplines and our traditional lines in research that we've built, right? That sort of status quo is not going to work, and that we have to sort of do things differently. So I think about that often, even now as I'm thinking about next steps, and that I really appreciate sort of having had that permission from the beginning, right? To say, I recognize this, do your thing.
And I think this is a very cultural thing, and MGH is centuries old and has a very special culture. And I would dare to say I completely agree with you about our current chair, Merit Sukovich, but that was the culture with Ann Young too. And when I was recruited onto the faculty, one of the biggest reasons I decided to stay at Mass General was that I had seen that over many years, that had been the culture. So if you think about people like Alice Flaherty, who's a neurologist, but also writes books and has even written children's books, or someone like Lee Schwam, who as a trainee was thinking of telehealth, which back then sounded like a very far-fetched idea, or even Lee Hochberg, who had the idea of BrainGate and putting chips in people's brains and to see how they could communicate better. They all had the freedom to follow their ideas and see them grow. And so I agree with you. That is a wonderful thing in the place that we live in.
Yeah.
And we're lucky for that. So I see a couple of comments.
I see two questions. Yeah.
Yeah. And one of them is about trust and safety, and how to create those spaces in the community. And I'll connect the other one, which is about your heart. So as you're navigating this work with communities and patients, how are you protecting your heart as you do this important work?
So I'll answer Samantha's first about sort of the feedback I've received from the community. And we have like a toolkit that we created. It's on a website, doctorsforimmigrants.com, if people want to check out the toolkit and videos. I think it's been really positive. I think that's been the most exciting part of this work, is I'll hear from, like just this week, I heard from people who are trying to push along changes in their hospital in New York City. I have talked to people across the country who've sort of brought in different aspects of this toolkit, and I'll meet with them and I'll say, okay, these are, from the model policies. So I think the feedback has been very positive. I think the part was about getting patient perspectives, and so that's what I'm engaged with now. Is they said, okay, well, you can, I don't know, let's say you can have a policy on what to do if ICE shows up. But is that as important as having, I don't know, a medical legal partnership, let's say, to address legal needs, right? And so it's like, well, what are people prioritizing? What's more important to them? So I think that is precisely why we're in phase 2 of the project, which is getting their perspectives, as the feedback that I got. And that project really came out entirely out of the community partnership. So when I had gone to LA and I was meeting with different immigrant rights groups, that had been something that had come up. And I was in a fellowship that was an interdisciplinary fellowship, the National Clinician Scholars Program. And so I was free to explore that, and it was really driven by the community organizations. And so I'm hoping to sort of keep seeing this across in many iterations. I think in terms of protecting my heart, I think it was the one concept that I think that's when I present my work, particularly around asylum seekers and refugees, and we have so many clinicians who are part of our asylum clinic. I think people are always struck by how hard the stories are, and they are, right? To document torture is not an easy task. But I think in as much as there is vicarious trauma, there's also vicarious resilience. I think we see that in our patients, right? That yes, there's incredible hardship that people deal with in their lives, but they are so incredibly resilient. And I draw from that strength. And I recognize how much often so much stronger and resilient they are. And the media displays, or that even our research displays, right? A lot of times our research is very much focused on, oh, here are all the deficits in these communities, or here are all the things that are a problem in this community that we have to solve, but really trying to center all the power that's within these communities. And so I actually draw incredible strength from them and the people I work with. I don't know if that probably is not the best answer to that question. I'm happy to talk offline, but
and I honestly think it is, because it's seeing the whole picture and being immersed in the work, not just with the challenges, but also with the joy and beauty that lies within people and communities. I love it. I love it. Well, I know we're at time. I just want to say thank you for being you. Thank you for leading this work. Thank you for becoming a neurologist and coming back to MGH.
Thank you, Nicte, for telling me to keep going.
No, it's a pleasure to chat with you today, and I'm so appreciative of everyone who joined us. I look forward to part 2 of this conversation, Altaf.
Okay, awesome. Bye, Nicte. Bye, everyone.
Bye.